I'll be answering your questions. Some of you have sent me questions on my TikTok channel after I posted some videos about the subject of cervical cancer and breast cancer. So in this video, I will answer some of your questions on the subject of breast cancer. The first question that you asked is, how often should I check my breast monthly? How often should I check for signs of breast cancer? So you need to check to do a breast cancer self-check, self-examination monthly. And you need to do that every 2 to 3 days after your periods. 2 to 3 days after your periods, you do a breast self-examination. Now, why particularly should you do it in that window of your cycle? The menstrual cycle comes with a lot of hormonal changes. So those hormonal changes, especially estrogen peaks towards the middle of your cycle, that's around day 15, and progesterone peaks about day 21 in a 28-day cycle. So these changes in your hormones bring about changes in your breasts. And some of these changes include swelling, slight swelling, breast tenderness, that's a bit of pain, and some lumpiness. So if you do a breast self-check in those other periods of your cycle, you are likely to misinterpret the changes that you find. That's why you should do it 2 to 3 days after your periods. Then also during pregnancy, there are hormonal changes. These are also estrogen and progesterone, hormones that are produced during pregnancy to keep the pregnancy healthy and help it to grow. So during pregnancy, you have those changes, and that's why it's important that you do a routine self-check to know the consistency of your breasts. Yes. So perimenopausal women also go through breast changes because of hormonal changes. That may also make you get the wrong results if you do not know your normal breast appearance. That's the first question I would like to answer. The next question you asked me is, Happy Doctor, should I do a breast self-check while breastfeeding? Should I do a breast self-check while breastfeeding? And my answer is yes. You should do a breast self-check while breastfeeding. But how and when should you do it? So the how, I have done for you a video on how you do a breast self-check. But the when, you need to do a breast self-check after breastfeeding or after pumping the milk out of the breast. Why? This is to make sure that your breast is as empty as possible in order to avoid misinterpreting what you find. So during breastfeeding, still, there are changes that happen to the woman's breast because there has been growth of the milk ducts. You find that the breast is full and sometimes will appear a bit painful, especially if it's full of milk. It will also be bigger. Yes, it will be bigger because the milk ducts are full of milk. So during breastfeeding, you may confuse signs of breast cancer with some changes in a breastfeeding breast. So I want to go through some of the things that you may misinterpret for signs of breast cancer during breastfeeding. Number one is breast engorgement. Breast engorgement is when the breast is full of a lot of milk before a mother breastfeeds, or if the baby is not breastfeeding as often as they should. Then sometimes the milk ducts are plugged and blocked. And so that may cause a bit of swelling in the breast and a bit of pain. Some women have what we call fibrocystic breasts, and this is genetic for them. So they have little swellings in their breasts. And then some women also have cysts. Cysts are little swellings in the breasts which have a bit of fluid in them. So some women may have cysts, and when you touch them, they are mobile. They move within the breast. Then lastly, a breastfeeding mother may also have an infection, what we call mastitis, that may come with pain and fever. And so if you do not know the consistency of your breast, the structure of your breast, you may confuse some of these for signs of breast cancer. Remember that breastfeeding reduces the risk of breast cancer. At least 12 months in your lifetime, you should breastfeed. But the longer the time you take to breastfeed, the better for you. The lower you reduce the risk. Now, I want to go to the next question that you asked me regarding the videos that I posted. Gift asked me, Happy Doctor, is every swelling under the armpit breast cancer? My answer to you is no. Not every swelling under the armpit is breast cancer. Swellings under the armpit can be caused by several things. However, I still emphasize a regular breast self-examination helps you to understand what is your normal and what is your abnormal. So what are some of the things that may cause swellings under the armpit that you should not mistake for breast cancer, but they should raise your ears to see your doctor? Number one, sometimes there are lymph nodes, swollen lymph nodes reacting, the body responding and reacting to viral or bacterial infections. Sometimes it is as simple as skin irritations after shaving, use of deodorants. You'll find that you have a bit of swelling in the armpits. After shaving, sometimes a hair follicle may develop a swelling. So you will check and find that there is a swelling. Some women have fatty tissue that has swollen and is in the armpit, and we call those lipomas. So some women might have lipomas in their armpit. Then cysts. You can also find cysts. I told you cysts are swellings that have fluid in them. And cysts are mobile. When you touch it, it will move. It will tend to move around. Then lastly, in the armpit, you can also have what we call abscesses. Abscesses are swellings. They are painful. They will be warm when you touch them. And if it's not treated early, they will begin to produce pus by themselves. So all those can cause swelling in the armpit. Remember, every time you are in doubt, please check in with your doctor and make sure you get the right diagnosis. Then the next question I would like to address is the issue of sagging breasts. So one of you asked me, Doctor, why do I have sagging breasts at a young age? So sagging breasts do not imply that you have cancer of the breast, but sagging breasts are caused by different factors. And I'm going to go through for you some of those factors. They are not necessarily always related to aging. So the first factor are large breasts, dense breasts. So dense breasts tend to sag because of the weight that they exert, that the breast tissue exerts on the skin. So large breasts will sag because of the weight of the breast and then the effect of gravity. Then the other factor that will cause you sagging breasts is rapid changes in weight. So there are people, they will gain weight, yes, and then lose weight. So when you lose weight, there is redundant skin that remains. And so that will also predispose to the breasts sagging, redundant skin. And of course, during the times when your weight is high, there is stretching of your skin. So when you lose it, that skin becomes redundant. Then the other issue is hormonal fluctuations. Hormonal fluctuations, especially those on hormonal treatments during pregnancy and puberty, will also cause breasts to sag. Then some people just genetically have sagging breasts. So it shouldn't be a worry for you. The other factors include harmful habits like smoking. So what smoking does, it damages the collagen. So there is a composition of your skin called collagen and elastin. So smoking damages that composition of your skin that helps to keep your skin straightened. And so that may also cause you sagging of the breast. The other thing that may damage your collagen and elastin is long-term exposure to the sun. So long-term exposure to the sun means you are exposing yourself on a long term to what we call ultraviolet radiation from the sun. So that also damages your collagen and elastin, which are responsible for keeping your skin stretched. Now, lastly, which you can actually do something about, is for women who engage in exercise. If you're engaging in exercise, you need to wear supportive bras. Supportive bras help to keep the weight of the breast in place, and they do help to counter the effect of gravity. And so your breast is able to stay in one place and you reduce the chances of sagging. Now, those are some of the factors that will lead to your breast to sag. The last question that I will address that you asked me about is on the issue of hormonal contraceptives. Someone asked me, Happy Doctor, are hormonal family planning methods also a risk factor for cancer of the breast? And the answer to your question is that hormonal family planning methods have a slightly increased risk of up to 1.2% for breast cancer. A slightly increased risk for breast cancer of up to 1.2%. But I want you to note that that risk increases with long-term use. And by long-term use, I mean 5+ years of using hormonal contraceptives, whether they are combined or not combined. Okay? So that increases the risk. So why do hormonal contraceptives increase the risk? The reason is that hormonal contraceptives contain estrogen. They also contain progestin, most of them. And these hormones cause stimulation, what we call hormonal stimulation. Chemicals called hormones. They stimulate the growth of cells in the breast. So if someone already has what we call stem cells, those are the cells that will eventually develop into cancer. So these hormones facilitate the growth of those cells. That's how hormonal contraceptives increase the risk. Okay? Remember, I've said that the risk increases with long-term use, and that's 5 years plus. But also, when someone stops, within 5 to 10 years, that risk significantly reduces. So, someone is asking me, so happy doctor, what do I do? The access that the family planning methods I have are basically combined hormonal contraceptives. These are some of the things you can do. You can look out for non-hormonal contraceptives. For example, there is an intrauterine device that is non-hormonal. And if you're in Uganda, this is available in the health facilities. You can opt for that. The other non-hormonal methods include the natural methods. These include timing your cycle and engaging in sexual activity on the non-fertile days of your cycle. That will also help you prevent pregnancy, but use non-hormonal methods. The other one you can use are use of condoms, barrier methods like condoms. They will also help you prevent pregnancy and avoid the non-hormonal methods. Then, of course, like I have said, avoiding harmful habits, smoking and alcohol consumption. I've told you that smoking increases the risk of breast cancer. So, avoiding those harmful habits will help you to reduce the risk, but also avoid the risk that comes with hormonal contraceptives. Then, the other advantage of hormonal contraceptives, by the way, is that it protects against other forms of cancers, reduces the risk, like cancer of the ovary, that's ovarian cancer, endometrial cancer, that's cancer inside the lining of the uterus, and then also cancer of what we call the colon, colorectal cancer. So hormonal contraceptives are entirely not a disadvantage. They can actually work to your advantage. So thank you for listening. Look out for more of my videos on wellness on my TikTok channel, The Happy Doctor, and YouTube, Dr. Happy Betty.